In September 2024, the Stride investigators, research fellows, project leads, scholarship awardees and supports met on the Gadigal Lands of the Eora Nation for the last Stride get-together. It was the culmination of 5 years of effort as the Centre for Research Excellence celebrated its work strengthening systems for Indigenous healthcare equity and to think about new directions. We wanted to use this as an opportunity to reflect on the legacy that Stride leaves, especially as it builds on 20 years worth of working together, reflecting more recently Indigenous ways of knowing, being and doing, and advancing international Indigenous scholarship.
It goes back a long way to when I was working in Darwin more than 20 years ago and interested in finding a way to do research that made a practical difference and work effectively in and with people in communities and people in health services. There was a long history of collaboration and building a program of research that originated in Darwin and then the top end of the Northern Territory and then spread to Central Australia and Queensland and South Australia and Western Australia.
It's a great opportunity to bring everyone together because we do come from right across the country, various states and territories. It's not often that we see each other in the same room. Stride actually started when the COVID pandemic lockdowns began. So for the first couple of years, we weren't able to see each other. So every moment that we get to spend together is precious.
One of the most powerful aspects of Stride's legacy is the way it has nurtured and supported the next generation of Indigenous academics and researchers. Some of our Stride mob shared their thoughts on what Stride has meant to them and the way that it has shaped their work.
And it was such an opportunity to get the scholarship through Stride, to be able to work part-time and continue and learn to do research and have that scholarship be able to support me to be able to do this and to do something that I think is really meaningful in Indigenous health. I feel so fortunate that I've had this opportunity.
I think the legacy I see from people who came before me is the space that they've created, the space that they continue to hold, and the encouragement that they bring for us young people to come into that space while it's still very safe and while it's still very held to take it up. To honour them as well in that process because I do stand on the shoulders of giants.
The way that Stride works for me is actually one of the best ways I've ever known coming into research. It actually amplifies the voice of Aboriginal researchers and ensures that we actually pay respect to relationships, and also anything that we do, we make sure that we're followed by community and followed by mob. We ensure that we actually open up our methodologies to ensure that it's actually appropriate for community. We understand that things take time, so the relationships are paramount with any work that we do, and we're actually able to work really close to our value systems. So we know that when working with community and working with mob doing groundbreaking research, that we actually are supported in being able to get the best results for our community.
Whenever I yarn to people about Stride, they are really surprised that research can sound so dynamic, so broad, so safe. Really blackfellow led, and it's important for collaborations to continue adapting, pivoting where necessary, taking on people's feedback, because ultimately we as researchers, we don't have jobs unless we have people. People give us our jobs, they give us purpose. So to be responding to community needs and to be responding to issues, especially groundswell issues, if there's something big, we want to be able to show how adaptive research is. And how it's not just your traditional academics and Western worldviews that make things valuable. There's so many other ways of measuring success.